Hi, welcome everyone. We're very excited today to have with us Lisa Federer. Lisa is the Acting Director of the National Library of Medicine's Office of Strategic Initiatives. She serves as Principal Advisor to the NLM Director on strategic directions of NLM, including open science analysis, evaluation, and reporting on NLM programs and activities. Prior to this, Lisa served as NLM's Data Science and Open Science Librarian, and previously served as the Research Data Informationist at the National Institutes of Health Library, where she developed and ran the library's data services program. She holds a PhD in Information Studies from the University of Maryland and an MLIS from UCLA, as well as graduate certificates in data science and data visualization. And today, Lisa is joining us to tell us more about the National Institutes of Health Data Management and Sharing Policy. So with that, I'll turn it over to you, Lisa.
Thank you. And thanks so much for the invitation. Happy to be here with all of you today. So as Sarah said, this is going to be an overview of the policy that you all have probably heard a little bit about, going into effect in just a matter of weeks now, so very close. And I want to, get the slides going here. There we go. So I want to start with giving a little bit of a background to the policy, where we're coming from, how we arrived at this point, why we have this policy. Talk a little bit about what goes into a data management and sharing plan, and then share some resources for writing a data management and sharing plan, things that will hopefully help you as you work with researchers at your institution, and raise your own awareness of some of the major activities in these areas. And then, as Sarah said, I want to make sure that we do leave plenty of time for Q&A. So keep those questions in mind, pop in the chat, and we'll get to those at the end. So like I said, I want to give a little bit of a background to the history of data sharing at the NIH. Although this policy is new, the history of data sharing is not. NIH has a mission to seek fundamental knowledge about human health and to use that to enhance health and reduce illness and disability. And NIH recognizes that data sharing is a part of making sure that we're able to expedite that translation from data to knowledge to actually bringing that into clinical practice in ways that can improve human health. So NIH has had a longstanding policy that the results and accomplishments of the activities that we fund should be made available to the research community as well as to the public at large. These are all taxpayer-funded activities, so the taxpayer should be able to benefit from that as well. So one of the first programs or projects that really had a very large data sharing focus was the Human Genome Project, which I'm sure many of you are familiar with, the first sequencing of the human genome. And since then, we've gone on to conduct lots of activities that do take advantage of really large scale science and data sharing. One recent one is the All of Us program that is collecting genomic information and data from people all over the country and making that available for researchers. So there's a lot of these programs that really recognize the value of sharing data and making data open to help advance our knowledge more quickly. We also have a number of policies that have been in place over the years to help encourage sharing of the various different outputs of NIH-funded research, including the papers as well as the data. The policy that's currently in effect today until January 25th of this month, of this year rather, is the NIH data sharing policy that went into effect in 2003. This only applied to relatively large grants. So about 25% of the grants that NIH funds fell under this policy. And it did not require a formal data management and sharing plan. It was more about the expectation that data would be shared in a timely fashion. And again, only applying to those that particular bucket of larger grants. Another thing I want to draw your attention to on this little timeline is the NIH Public Access Policy in 2008, which applies to publications and is still in place today. This policy requires that NIH-funded researchers make the articles that they publish available with no more than a 1-year embargo for those. And you may be familiar with the Nelson memo that came out, I think around September of last year, that actually is going to require agencies to develop policies that require researchers to make those publications available immediately with no embargo. So keep your eyes on this space. There will be some changes in the next couple of years to this public access policy in response to that memo. Another policy that I want to draw your attention to is the genomic data sharing policy that went into effect in 2014. And this policy applies to human and non-human large-scale genomic data, so things like genome-wide association studies. And this policy is a little bit different from the previous 2003 policy and the current 2023 policy, because it's a little bit more prescriptive in terms of where you're supposed to share and how you're supposed to share. One of the things that you'll see as we talk about the policy today is that it's very open-ended because of the fact that NIH funds so many different types of research. We have 27 institutes and centers that fund a whole, gamut of research from basic science research to bioinformatics kinds of things, some social sciences. So it's really difficult to say, you should share your data in this repository, or you should share it in this way, because there are so many different norms for the different communities that NIH works with. The genomic data sharing policy, like I said, is different because it has, it applies to really kind of one specific type of data. So it's a little bit more prescriptive. So with that background in place, let's talk about what's next, the NIH data management and sharing policy. So this policy applies to research that is funded in whole or in part by NIH that generates scientific data, and this includes all types of funding. So grants are probably what you're most familiar with at your institutions, but this also applies to contracts. It also applies to intramural research projects. So about 80% of NIH's funding goes out to extramural programs at institutions like yours, but the remaining 20% stays at NIH, and we do have this intramural research program here in Bethesda, as well as in a few other parts of the country, and those researchers will also have to comply with this policy. And then there are some other kind of random funding mechanisms like other transaction authority, and all of those, basically any type of money that you're getting from NIH, provided that it generates scientific data, does fall under this policy. This does not apply to funding that does not generate data, so things like training grants or infrastructure development. And on the I don't have a link to it on this page, but I have a link on the very last slide. There's a sharing.nih.gov website, and they have like a guide to funding mechanisms that do not generate data and therefore do not fall under this. And I have put links to, where possible, additional information, because there is a lot to dive into here. And I believe the slides will be shared afterwards. So if you want to dig into any of this a little bit more deeply, hopefully that will help you to do so. So the policy requires basically two things. One is the submission of a data management and sharing plan, which outlines how scientific data and accompanying metadata will be managed during the life of the project, as well as shared beyond the life of the project, and identifies any potential restrictions or limitations on sharing, which we'll talk a little bit more about. And then once that plan is submitted as part of the grant proposal or funding proposal and is accepted by the program officer, compliance with that plan does become part of the terms and conditions of the grant or other funding. And so it is expected that the awardee will actually carry out what they have said that they will do in their plan. So there are 6 sections or elements of a data management and sharing plan. And I want to mention that the NIH has put out a template that goes a little bit more in depth into each of these. And there's also a lot more description, again, on that sharing.nih.gov website. We'll walk through each of these and talk a little bit about what goes into each of these sections. So first, we have a description of the data. This includes the type and amount of data that will be collected or used. So this might be the modality, like we're going to have imaging data or genomic data, the level of aggregation, whether it's individual versus aggregated data, as well as the level of data processing. Sometimes it's appropriate to share the raw data, other times that's not terribly useful, and so the processed data would be shared. This section will also address rationale for data that are not shared for example, legal or ethical reasons. And this section also should include what metadata and documentation will come with that data to help people who want to reuse this or look at it make sense of it. That might be metadata standards, it might be study protocols or code books or data collection instruments, any of those sort of ancillary items that you would need to make sense of the data. So a question that sometimes comes up is what counts as data for sharing? One thing that I think most people would recognize is that we would want to share data that's adequate to replicate and validate study findings. So if I publish my article, a lot of journals already expect this, but now the NIH policy also expects that data that supports that article would be made available at the time of publication. But this policy also does apply to data that come from a study but don't necessarily result in a publication. For example, sometimes people unfortunately have null findings that don't result in publication, but that data still has potential value, and so the expectation is that that data would still be shared even though it doesn't have a publication that goes with it. In terms of what does not count as data for sharing, it's really more of the preliminary, non-final product sorts of things that you might think about. So things like lab notebooks where people have been, keeping the results of their experiments and making notes and things. Case report forms that you have like people fill out when they're participating in a study. Drafts of scientific papers or peer reviews, emails with your colleagues, these sorts of things that are not final data that would go along with a study. And then another thing is any sort of physical objects. This policy only applies to digital data. So sometimes studies have things like biospecimens, and that does not fall into this policy. I've alluded to some potential limitations to sharing, and there are some acceptable reasons to not share. I think it's important to recognize that NIH is well aware that there are many studies that we fund that involve human subjects, and so it's not appropriate to just put the data out there for anybody to see. There are, of course, important limitations and privacy concerns that need to be taken into account. So there are acceptable reasons to not share that you might reference in your plan. This might include things regarding consent. It's really important that any human data, the participants have explicitly consented to the sharing in their informed consent. So there may be scenarios, for example, where a study is continuing and they have data that's already been collected from people, but that consent did not include that sharing. So that, of course, would not be appropriate for sharing. There's also scenarios where it's not really possible to adequately de-identify data. Things like, small patient populations, rare disease. There are just times when you can't ensure that you can de-identify data to an extent that you can be sure that there's no risk of re-identification or harm to the participants. So certainly in those scenarios, there are, potential opportunities to share in controlled ways, or maybe appropriate to not share certain parts of that data. Also, whenever any sort of federal, state, local, or tribal law or policy prohibits disclosure, HIPAA is an example that may come into play here. And then finally, data sets that cannot be digitized with reasonable effort. So if there are things that, again, things like biospecimens or other non-digital data that cannot reasonably made digital, that would be an acceptable reason not to share. So the next section of the plan is the related tools, software, and code. And this is whatever tool it is that you might need to access the data once it's been shared. This might be a specific software tool, like we used SPSS, or you'll need Python. And it should also address the availability of the tools. Is this an open source sort of thing that anybody can get access to? Is it something that has to be purchased? And then finally, the expected lifespan of the tools compared to the length of data availability. One of the things with the policy is that there's not a specific set time that it says data has to be available for 5 or 7 or 10 years, because again, there are some disciplinary differences in expectations and norms around length of data availability. But if whatever the data availability length is planned to be, ideally the tool should be available so that if I come and use this data that's available 10 years down the line, the software is still available for me to be able to actually access it. The next section addresses standards that will be used, and this could include things like data formats, data dictionaries. This might include common data elements or CDEs, which are basically standardized ways of defining variables and allowable responses to questions. So it might be, if we want to collect a participant's height, we define that it'll be collected in feet and inches, for example. This might also include definitions of things that you might need to discuss with regard to standards. And in some cases, there's not really a consensus standard for certain types of disciplines or types of data. There are some communities that have really robust sets of standards that have been well developed over the years, but especially in kind of emerging topics, there may not be a consensus standard. So in this section, you would indicate when that is the case. Next is the data preservation, access, and timelines section. And this is an area where I think actually librarians have a lot of opportunities to help researchers out with the identification of repositories where data will be shared. We'll talk a little bit more about some repository options and evaluating repositories. But again, NIH has not been prescriptive about what repositories, specifically anyone should use, just because there's so many, and it would be really hard to point people to one that would be a one size fits all. So investigators should locate an appropriate repository where their data will be shared. And this may be multiple repositories. In many cases, studies generate more than one type of data. So it may be that my genomic data goes in one repository, but I also have imaging data and that goes into a different one. This section should also address the findability and identifiability of the data. Ideally, you don't want to just have my data will be on my webpage where no one can find it. You would address here, for example, that the repository is indexed and people will be able to search, that it has, DOIs so that people will be able to identify it afterwards, those sorts of things. And then this section will also address when the data will be shared. The expectation is that it would be shared no later than the time of publication for accompanying articles, or for other data that doesn't accompany an article by the end of the performance period of the grant or other funding. This also is where you would address how long data is anticipated to be available. And again, there's not a single, prescribed length of time. This will be dependent on individual, disciplines and guidance from the program officer. The next section is access, distribution, and reuse considerations. This section would address things like informed consent, how participants will agree to have their data shared, what sort of privacy and confidentiality protections will be in place to ensure security and privacy for participants, and then any other restrictions that might be imposed by federal, tribal, state laws again. This might also be an area where you might address things like, reuse licensing, like will this be Creative Commons, will this be something else, and how access will be made available for people. And then the final section of this is oversight of data management and sharing, which involves how compliance with the plan will be monitored and managed. So who is it that will be responsible for ensuring that these activities happen in a timely fashion, and how often will those oversight activities occur? Ultimately, it is the PI's responsibility to make sure that what they have said that they will do gets done, but this section might include, specific named personnel that will be involved with data management. So that covers the components of the plan. The kind of workflow or timeline for this is that the plan is submitted with the application for funding, and there's also a budget justification that's included. The peer review of the materials related to the plan, the peer reviewers can comment on but not score the budget itself. But the plan is actually assessed by NIH program staff, the program officer. So that peer review is not really, the plan is not something that is scored as part of peer review. It's more assessed by program staff to ensure that it is appropriate, and those program officers will work with grantees to, ensure that any changes that need to be made are made. And then once the plan is accepted, plans can be updated in collaboration with the program officer. Grants can last for a while and things may change. There might be a new repository that's more appropriate. So certainly if things need to change, there is a mechanism for updating plans over time. As I mentioned, in terms of compliance, the plan does become incorporated into the terms and conditions of the funding. So it is an expectation that those will be carried out. And there is monitoring at regular reporting intervals. So researchers already submit basically like progress reports on how things are going with their funding. And this is something that they would be reporting on in those sorts of reports. And important to note that compliance can factor into future funding decisions, not only for the individual researcher, but also for the institution as a whole. So I think it would probably be a pretty egregious situation where NIH withheld funding to an entire institution, but institutions should be aware that it's really important that their researchers are complying with what goes into their plan to, not raise the possibility of potentially future funding complications. So this policy does represent the minimum requirements for all of NIH, but individual parts of NIH, so institutes and centers and offices, or ICOs, as they are known in our lingo, may provide more specific guidance. There may be even more specific guidance for a particular program or a specific funding opportunity announcement. So the funding opportunity announcement is a good place to go for any other specific information that may apply. And I'll say several times during this that the program officer is always going to be your best resource for any specific questions you have for a particular application. And then also other policies may apply to certain activities. The genomic data sharing policy is one, although I will say that they have done some work on that policy to align it with the data management and sharing policy. So if you do have that type of genomic data, there shouldn't be too much overlapping, stuff that you have to do, or I guess it is actually overlapping. The two policies are aligned, so you shouldn't have to do two separate pieces. But again, refer to the specific funding opportunity announcement and the program officer for any questions about what policies apply to a specific instance. So that covers the what of the data management and sharing policy and plans. And I want to talk a little bit now about some resources for writing a data management and sharing plan, some tools and additional guidance that I hope will be useful for you and that you may consider passing on to researchers at your institution. So one question that a lot of researchers have is how to estimate the budget, how to estimate costs. So there are certain allowable costs that can be, included in that budget justification. That includes data curation and development of documentation, as well as local data management. So basically during the project, before submitting to a repository, and then any costs that are associated with preservation and sharing in repositories. One caveat there is that all funds do have to be expended by the end of the period of performance. So if, for example, you're submitting to a repository and you want to make your data available for 10 years and they charge you like each year for that, that would not be possible with this. You would have to spend all of the funds during the period of performance, not after it ends. And then with this, it's also important that there's not any like double dipping on things. So if, for example, your institution already has an institutional repository that is funded by like overhead costs from NIH grants, you can't ask for additional funding for that because it's like already paid for by an NIH grant. So again, people may not really know, like, how much does it cost to generate data documentation, or what does it cost to share data in a repository? So one resource for that is the National Library of Medicine funded a study by the National Academies a few years ago that looked at forecasting costs for preserving, archiving, and promoting access to biomedical data. And this study put together basically a framework for how to think about what are the costs that are associated with these things, and how might I estimate what those costs might be. So it doesn't have, like, a repository costs X number of dollars, but it does give a useful framework for thinking about and estimating what those costs might look like. The framework involves 3 different data states. So they posit that data has these 3 different states, and it transitions between and among them at various different parts of the study. So we have this first state, which is the primary research and data management. So while the research is going on and the data is being collected and hopefully managed, during that project. And then state 2 is when the project is finished, most likely, and the data moves to some sort of a repository or platform, and there's a set of activities that go along with that. And then the third state is long-term preservation. This might be something where it's almost like kind of a cold storage, where you don't have the data on an active repository, but it is available long-term. It's being preserved and managed, and is available if people would like to access it. And again, data can move among these different states. So you might, move from state 1, where you're collecting the data, to state 2, where it's in a repository, and then it gets kind of older and you don't need it like actively in a repository before, so you preserve it, but then it becomes useful again, so you move it back to a repository, and so on. So again, each of the different states has these activities associated with them that are involved with maintaining the data at each of those different periods of time. I won't go through all of this, but this is this cost forecasting framework that helps researchers to think through what are the considerations that I should be thinking about in identifying what some of the costs might be that are associated with each of these activities involved with managing and sharing data. I also share this checklist that they have called a checklist for administrators at research institutions, but I think it would also be really useful for librarians. It involves thinking through how to foster implementation of the framework at an institution and ways to improve awareness of it for researchers. Some institutions may actually want to update their own policies and procedures around data related to this, so it has some guidance there. And overall, the idea is how to help expand the capacity to make sound data management decisions at the institution. So a useful resource that I point you to as well. So switching gears a little bit, I mentioned that one challenge for researchers can be figuring out, where do I even put my stuff? The repository landscape in biomedical research is fairly complex and large, so this can be a bit tricky for people sometimes. Where possible, NIH really encourages the use of subject-specific and open access repositories. I'll talk a little bit more about some resources for locating those. It makes data easier to find when it's in a place where it's, with like data. And so when such a thing is available, that is the ideal place to share data in one of those subject-specific or discipline-specific repositories. However, there's not always an appropriate home for every data set, particularly, again, emerging types of fields where there may not be well-established repositories. And so there are other ways to share data outside of these subject-specific repositories. One option is for data that goes with an article that's in PubMed Central, which is the free open access archive of literature that NLM hosts. Small-ish data sets up to 2 gigabytes can be stored along with those publications as kind of supplemental materials. So that may be an option if your article is in PMC, which most NIH-funded articles are, because that's how you comply with the public access policy. For larger data sets, up to 20 gigabytes in most cases, there are generalist repositories that will accept essentially any kind of data, regardless of discipline, subject, format, whatever it is, you can likely put it there. I'll talk a little bit more about some of these generalist repositories, but these can be a good option, again, when there's not, a natural home for a data set. And then for very large and high priority data sets, there is the STRIDES program, which is a cloud partnership that NIH has with the three major cloud providers, Amazon Web Services, Google, and Microsoft Azure. And this is a program through which you can get some discounted cloud storage through NIH. And NIH is also putting some of their high value data sets on these cloud providers, so they're available for people. So if big data is your thing, STRIDES may be a solution there. So as far as these subject-specific repositories go, one place that you might look for finding an appropriate one is a list that's maintained by the Trans-NIH Biomedical Informatics Coordinating Committee, or BMIC. BMIC has maintained a list of repositories for the last several years, and we're actually currently in the process of overhauling that list. So in like a week, hopefully, we're going to have an entirely new site design with some new repositories listed, and that may be a helpful place to locate a repository for one of those domain-specific or subject-specific use cases. This list is also mirrored on the sharing.nih.gov site, so you can find it there as well. I mentioned generalist repositories, and I want to speak briefly about an activity that has been going on for about a year now through NIH funding, which is GREY, or the Generalist Repository Ecosystem Initiative. So there are a number of these generalist repositories, and a lot of them have similar goals. And so NIH got applications from generalist repositories to work together on things where it would be beneficial for them to cooperate and have things like consistent capabilities. The goal is to create better access to and discovery of NIH-funded data, as well as to conduct outreach and training for researchers about good data practices in general, making data fair or findable, accessible, interoperable, and reusable, and work really closely with the research community on all of this. So the outcomes, we hope, will be to make it easier to both share and discover NIH-funded data, and thereby increase reproducibility of research, and also encourage secondary reuse of that data. So, it would be great if other researchers can find and make use of data that's shared. I won't go through all of this, but these are some of the objectives of GREY. Overall, I would say the overarching one is this commitment to coopetition. This concept came out of a generalist repository workshop that we held at NIH back in 2020. It's the last meeting that I went to in person. And the idea was that these generalist repositories have certain areas where they want to cooperate and collaborate on things, but they also are competitors. There are certain things where they have their own kind of value proposition, and that is what makes them competitive in the market. So we recognize that, they will have their own unique sort of approaches, but there are these things that they can work together on. So things like consistent metadata models, which will hopefully in the long run make it easier to do federated search across repositories, things like open metrics, so that we have a good feel for usage in these repositories and we can compare apples to apples. And again, outreach and education to help researchers be aware of generalist repositories and how to use them to share their data. And actually, the slide's out of date. I'm missing. We had a repository that was added to this. So we actually have 7 that participate. We have Dataverse out of Harvard, Dryad, Figshare, Mendeley Data, the Open Science Framework, and Vivly, which is a platform for sharing clinical data. And the 7th one is Zenodo, that I am very sorry I did not list them because my slide is out of date. So we do have all 7 of those participating. switching gears again, I want to talk a little bit about some supplemental guidance that came along with the NIH policy and also has come out of the Office of Science and Technology policy as the desirable characteristics for data repositories. These are a set of 10 characteristics that can be basically ideal, what we would like to see in a repository. So this list was created both for researchers to help them assess repositories. So if I'm thinking about using this repository, how do I know if it's a good one? These are some ways that I could, verify that they're complying with, or not complying with, but adopting best practices for data. And also useful for NIH as a funder to evaluate the repositories that we are funding to ensure that they are high quality. So these 10 characteristics apply to all data repositories. And again, I won't go through all of this, but there are things like, do they have a long-term plan for sustainability? We, don't want to put all of our data somewhere and then in a year it goes away. What are they doing in terms of quality assurance? Is it free and easy to access the data? What are they doing in terms of security and privacy to ensure that appropriate safeguards are in place? There's also a set of 9 additional considerations for human data because, of course, with this, there's some more sensitivity. So in many cases, it's not appropriate to put data in a fully open repository, and it's more appropriate to use some sort of controlled access repository. So in this case, with this type of data, we want to make sure that there are safeguards in place like fidelity to consent. In some cases, an informed consent form, people would agree for their data to be reused in a specific way. Like you can only use this in studying eye diseases and not something else. So important that those repositories that house that data make sure that any proposed reuse is consistent with what people have consented to. Things like privacy and plans for a breach, like what happens if something, some security measure does need to be put into place for a breach, and also things like violations for if you give the data to somebody to reuse and they don't reuse it in an appropriate way, how do they plan to address that? And then request review. So in many cases, these controlled access repositories have like a data access committee or some other oversight group that reviews those data use requests. And so that's important to know that that's there to ensure, again, the appropriate use of data stored in these types of repositories. So with that, I will stop there and happy to take any questions.
Lisa, we have a number of questions that have come in through the chat, and some of them I feel have already been answered. And so I'm going to state those. And if the person that asked feels otherwise, please put back in the chat. Jennifer Bocher actually said her question was answered. It was about budget standards. Dan Gilman from the BLS had a question about use of metadata standards. DDI is a common standard in the social sciences. I feel you've addressed, the fact that standards are different in different fields. Catherine Lavender from ICPSR asked if you know of the data from NIH that is shared, what percentage goes to what repository?
It's a really interesting question and a really hard one to track. So I think hopefully in the future, there will be some like machine readability of these data management and sharing plans once we actually start getting them, so that we might be able to mine those plans to see like where are people saying that they're going to put their research. There's also some possible capability of doing things like mining the literature for finding like, this article says the data set is here. However, it's a very tricky question that we don't currently have a good way to answer, but I think it's something that NIH would definitely be interested in. So I'm hoping that once the policy goes into place and we are collecting these plans, there will be ways to do some of that tracking because it's definitely a super interesting question.
Great. And then Catherine had a clarification question. She said, data is being shared with the repository in this sense is also equal to the data being shared with the research community and accessible. Is this right? I asked from a repository perspective, where there is time between sharing with the repository and making the materials available to the research community.
Okay, yeah. So if I understand properly, so I think it sounds like this is kind of a scenario where it's almost like there's an embargo, like maybe somebody puts the data in the repository, but it's not for whatever reason ready to go to the public yet. I think I'm understanding the question properly, but please jump into the chat if I'm not. The standard, the expectation is that the data would be shared by the end of the period of performance or the publication of the article, whichever comes first. So as long as that deadline is met, I think that is fine. But again, I may be misunderstanding the question, so please let me know if that's the case.
Specifically, I mean, Catherine did clarify, and I could have probably. So Catherine works at ICPSR. So there's open ICPSR, where of course things just go in and it's as is. And then there's the membership archive where things are curated. So if I submit something today, it's going to take a while because they're going to go through and make sure all of this. So I think the question is, and Catherine, please clarify if I'm wrong, but what is the date considered essentially, since it will take some time to do the curation and so forth? Is it enough perhaps that it's been deposited into a repository knowing that it's going to get really good treatment at a future date?
Yeah, I think this again would be a good question for the specific program officer and a discussion that I think an investigator could have. But yeah, I think it's sort of like how with the public access policy right now, like let's say that you have a journal that you're publishing with that does require the year embargo. You do have to go ahead and submit your article to PubMed Central. So it's in the system and it's like there and we know it's there and it's just not going to get, released until that year deadline happens. So I think in these sorts of scenarios where there is kind of like a lag period between when the data is shared and when it's available, I think that shared piece is probably what we're looking at.
Great. Barry Hayes asked, several months ago, the NIH sent out additional information indicating that the DMSP process would be streamlined to reduce administrative burden for researchers subject to both the new NIH DMS policy and the genomic data sharing policy. Has there been further clarification on what the streamlined administrative burden reduction will mean? Do researchers still need to complete both plans at this point?
Yeah, so that was that alignment with the two policies that I mentioned. And I'm not sure if there has been additional information from what you saw, Barry, that you referenced. That sharing.nih.gov site is going to be the best source for most up-to-date information. And I know that they do address their, questions about the GDS policy. So I would go there to make sure you have the most up-to-date information.
All right. And then a quick question was, when you were talking about strides, what qualifies as high priority data?
Yeah, so I think that's actually more, there's two pieces to strides. There's the, ability for NIH funded researchers to get access to the discounts to work with these cloud providers, and they can, put whatever their data is that they want to put there. There's also the piece where NIH is actually looking at our own data sets and looking at things like, what do we have at NCBI, the National Center for Biotechnology Information at NLM, that has a bunch of data repositories, and what are some of the ones that NIH considers high priority and wants to make available in the cloud. One that has been worked on to this date is SRA, the Sequence Read Archive. So I think that high priority piece is more related to NIH's decision making around what goes into NIH's cloud, but researchers that take advantage of the Strides program, as far as I'm aware, can put whatever they would like in the cloud.
So one question was very specific, and I'm going to read it, but then I'm going to generalize it slightly. And this was from Gabriel Hayden. I have a patron who expects to have 15 terabytes of light sheet fluorescence microscopy images that he doesn't know where to share. Do you have any suggestions for a repository? Currently, he is proposing just the metadata in our institutional repository and saving on Dropbox, which is obviously subpar. So, I mean, this is a very specific, and you talked about the fact that there are a lot of different options out there. And you mentioned, often the librarian, is the person that can. But what happens when we don't know? Like, is there someone at NIH could say, for this very weird data, this is what we recommend?
Yep. So I'll say again, the program officer would be a great resource in that case. I would highly suggest that you encourage them not to use Dropbox. That would not be ideal. But generalist repositories might be an option. If it's 15 terabytes, that is probably too large for a generalist repository, but there might be cloud options that would be available. But overall, I would say, referring to those repository lists that I mentioned, the BMIC repository list, that same list is mirrored on the sharing.nih.gov site. Right now, it's a pretty bare bones list, but we are adding a lot more like metadata about the repositories, and it will be a lot easier to like search and filter the list. So you might be able to locate something there. That list is a relatively constrained list in terms of like looking at the entire universe of repositories that are available, because these are ones that are identified as either being funded by NIH or being high priority to NIH researchers. But there are other lists of repositories. So like Re3 data is one, RE, the number 3 data. There is fairsharing.org. Those are both lists that are a little bit more kind of open to not just biomedical research. They cover all disciplines, and they have things that are not necessarily NIH funded. So it's a little bit larger universe of data sets. So if you don't find something on either of the NIH lists, that might be a good place to look. And another thing is just kind of figuring out like if there is a norm within that kind of research community, which you might find by like, look at some articles that are covering similar types of data. Where are they putting their data? So it can be a really tricky question, especially with those, some stuff is very obvious, like this goes here. But other stuff, it is a little bit trickier to figure out what is the right place. But I think there's various different resources that hopefully can help people find a good answer. And again, program officer is always a good resource.
Michelle Leonard had a great question. Are there exceptions for intellectual property and patents when sharing data?
Yeah. This is a tricky question, and one that I don't like to answer, but my understanding is that, no, there is not. I think, the exceptions that we talked about, the things like privacy of the participant, those sorts of things are acceptable. I want the data to use for myself is not necessarily an acceptable answer, but I know that there are certainly, intellectual property considerations that have to be taken into account. And again, this is something that I think would be a good discussion with the program officer.
Okay. And then Robin Rice, who is from the United Kingdom Data Archive and the vice president of our organization. And just for those that came in late, just a reminder, this webinar is brought to you by iAssist, and we'll put the link in again, but we would love to have you as members, but this is free. Robin, that said, is from the United Kingdom, and she said, asking from a non-US perspective, how big an impact do you expect the policy and implementation to have on researcher communities, research institutions in the United States, and funders outside of the United States? And Robin reminded me she's actually from the University of Edinburgh, which participates in UKDA. But anyway, so essentially, what impact do you expect this to have for places outside the US?
Yeah, I think a lot of other agencies are moving towards doing similar types of things. I know there are a lot of European agencies that actually in some ways are ahead of the US on this. So I think, this is kind of becoming a little bit more of just a standard for science, that we are moving towards more of an open science paradigm and less of a closed science paradigm where we, keep all of our data and all of our, stuff in our lab or whatever. So I think I think this is one part of a larger sea change maybe in the expectations and norms around how we conduct research. I think it'll be interesting to see over the next couple of years really how this changes the amount of data that's available. I don't think we have, right now, obviously people can share their data if they want to. There are a lot of publications that require sharing of data. So many researchers probably are already doing some of the things that are described in this policy. But I think it will be really interesting to see over the next few years how this changes the amount of data that's made available to the broader research community. So I think it's a bit of an open question to see what happens as we tread into these new waters.
Thank you. And we had a suggestion in the chat for those of you not reading the chat, but Boson, who's a member of our committee, recommended Gene Bank as the possibility for Gabrielle's question. I think I got everything. Sarah, did I miss any questions?
I don't think so, Bob Ray. I think that was it. Are there any other questions from the audience at all? Doesn't look like it. All right, I think
so. This has been incredibly helpful.
Yeah, and Becky's slides will be provided as well.
Yes.
Yep. Yeah, thank you so much, Lisa. This has been
my pleasure.
Really
I hope this has been helpful. Thanks for your great questions. And I've mentioned it several times, but definitely encourage you to check out the sharing.nih.gov site. They have like FAQs. They have done a couple of webinars where they really dive more into some of the nitty gritty of like how to submit stuff in the system. So those sorts of questions, definitely check that site for that. And again, keep an eye for new things as they come on that site. So thanks.
Great. Thanks, Lisa. And thanks everyone who joined us.